What is the philosophy behind upper cervical care, or why do you approach healing the way that you do?
Well, I approach upper cervical chiropractic care as the primary method of which I am able to help people through chiropractic for the express purpose that it is the most important level of the spine. The craniocervical junction or the upper cervical spine is a balancing spot for the rest of the spine to be able to function at its best. But in addition, over the last 5 years, we've learned the importance of how much is involved with the upper cervical spine having an impact on brain health, which is certainly the most important thing that we can do.
Awesome. How have you seen upper cervical care improve or advance throughout your career?
Well, I've been in practice over 20 years, and I knew virtually very little about the upper cervical spine when I started practice. But through personal experience and through clinical correlations, I found that that was an area of the spine that I just wasn't able to help people with very well. And I could tell that there were persistent problems in a portion of my patients. So the more I identified that, the more I searched for alternatives or ways of being able to better correct that, I found out that I needed to have specific training in upper cervical chiropractic. So in the last 20 years, it's changed an awful lot for me personally. Thankfully, we've had pioneers that have been working with the upper cervical spine for upwards of 30 or 40 years. And as a result of that, chiropractic, upper cervical chiropractic healthcare is something that has continued to advance. But the other major change is that of advanced imaging technology. We've known for many years that the upper cervical spine has an effect on immune system health, on brain health. We help people with fatigue, brain fog, sinus allergy problems, post-concussion syndrome. And we know that it works, but the advanced imaging allows us to validate this scientifically, that things are occurring in there and that changes are happening that do indeed impact brain flow or brain stem pressure and functions of the brain.
So, I mean, you kind of already answered this, but if you have anything to add, how have you personally changed through the advanced studies of the Diplomate program and other continuing education?
Okay. Well, the advanced studies of the Diplomate program has been very much challenging to me. Over the last 3 years, I've been exposed to different upper cervical techniques, and though we share an awful lot as far as our approach, there are some differences that have helped me to be a much more well-rounded upper cervical chiropractor, to be able to understand the differences and how to be able to expand my services, to be able to work interdisciplinary with other professionals, and certainly to understand the value and the benefit of what we do on a regular basis to help patients.
Okay. What kind of quality of care could a person expect from a diplomate in chiropractic craniocervical junction procedures?
Well, a patient can expect an awful lot more from a diplomate of the craniocervical junction procedures. Number one, we have the latest in training and technology. We have the most well-rounded education when it comes to being able to correlate the specific problems that a patient may enter with and be able to go much further beyond what might certainly be expected of the average chiropractor, or even when somebody is specifically seeking out an upper cervical chiropractor.
What kind of conditions can be understood, cared for, and properly managed by a diplomate that would not normally be a chiropractic candidate?
Well, there's a number of conditions that can be helped with upper cervical chiropractic that is normally not considered to be a chiropractic problem. One would be post-concussion syndrome, where we can manage those type of symptoms and problems, those that have vertigo or dizziness, those that have severe forms of headaches, migraine, cluster, tension, certainly those that have neurodegenerative problems such as MS or Parkinson's and the like. Those are conditions that can be managed with upper cervical chiropractic care.
Can you please share one or two brief stories of complex or profound cases that you helped through upper cervical care?
Well, yes. I want to share a few cases with you that have benefited from specific upper cervical chiropractic care. One gentleman by the name of Mark came into our clinic, and he had been to several other chiropractors in the past and thought that he might be able to get some relief from some neck and back pain and some numbness and tingling in his arms and legs. But he also came in with seizures, and he had been having seizures for a few years, could not take the medications because he couldn't work. And what I found out later is that he also had a lot of problems with anxiety and with really just controlling his temper. He was always on edge, he was always anxious, and could snap very easily. This was affecting his work, his home life. It was affecting his entire life. And so when we started working with him, he had had seizures on a very regular basis, but after his first correction, he no longer had seizures. But after several years, we had been having to adjust him every 2 to 3 weeks. With the expansion in our services, the more specificity of the work that we did, we are now able to see him at about a 3 to 5 month interval and keep him in much better condition. This gentleman also had had fusion surgery to his neck area, and so we're able to safely work with those conditions and problems. I'd like to share another case with you of a young lady that came into our clinic, and she was also post-surgical. She had had a fusion in her neck area. She was hoarse. She was having horrible migraine headaches. And she had moved into the area. A chiropractor from her hometown in Michigan and referred her down to our clinic. But she was expecting to get the regular manipulative type chiropractic adjustments, which helped her. When we introduced upper cervical chiropractic care, she was sort of resistant to that. The fact that we used a percussion instrument, that she could not feel the adjustment happen. She came into our clinic that one day that I recall, and she was in sunglasses, even inside, and she could not process, she could not think. Her husband was helping her, but after the adjustment, even before she left, sunglasses were off, smile was there, and she was starting to recover from the migraine headaches. She went on to doing very well, and her migraine headaches dropped from being almost a daily thing to her rarely, if ever, having another migraine headache. And again, we did that all with her having a fusion surgery. Even the hoarseness problem that she experienced did somewhat improve.
When someone experiences an alignment of the craniocervical junction, what are some of the mechanisms behind the healing?
Well, in chiropractic, we talk about the importance of letting the body function as it was intended. So when we approach these sort of conditions, our goal is to restore the normal alignment, the normal balance, and restore the body's ability to heal itself. The way that that is done in our practice is because of this type of care we take, the sort of precision of the x-rays and the evaluation. The extent to that we do that allows for the adjustment to work much more effectively, much more quickly, and in the long run to be able to hold and actually correct these problems more consistently and more completely. In other words, actually be able to correct these problems on a more permanent basis.
Why do other doctors not know about or understand this problem, the craniocervical junction misalignment, or about the solution of cervical care, and in a way that doesn't put down doctors, but rather help the public learn about the secret of cervical care?
Sure. Yeah. The craniocervical junction is an area that is shrouded in a lot of misunderstanding. There is rightfully some concern about this area of the upper neck area. That's a very crucial spot. It's certainly a junction box, if you will, for the brain functions. And there's arteries that are running through that area. So I think there's two areas that doctors have concern. Number one is it safe? And we've been able to prove over many years of experience and with different research that's been done that these sorts of very specific, gentle approaches, which are painless, do not cause these sorts of problems and are very safe. Over 100 times safer than some of the very common medications that are prescribed for the conditions that we most commonly see. I think the second thing is effectiveness. There is a misunderstanding because of just a lack of knowledge that upper cervical chiropractic is very effective. It helps the patient to restore this balance and alignment. And because of injuries, because of traumas in the past, which most all of us have endured some of those, if not many, these patients are left to figure it out for themselves. That's something that we want to change. We want to be able to communicate and be able to work with doctors and be able to take on some of these cases that have really run out of viable options. Chiropractic, upper cervical chiropractic care is one of these options that is viable but is misunderstood and perhaps not appreciated for what it is.
Excellent. Okay. Last question. What is your personal mission in upper cervical care? Like, why do you do it?
Oh, my mission in upper cervical chiropractic care is really simple. I want to help as many people as possible live a healthier, more productive life. I've been put in chiropractic to make a difference in people's lives and with their health care in a long-term basis.